Yes, you can go live. Unmute.
Good morning, ladies and gentlemen, and welcome to Tacopsia 2020. It has been one long year since the last Tacopsia, which was a glittering event. The world itself has since changed unrecognizably, and we are currently in the midst of a pandemic, the likes of which we have never seen before. The upshot of this whole thing is that the pandemic has also spawned an epidemic of webinars. So TACO took a collective decision to keep this year's Tacopsia short and sweet. We intend to stick to the core agenda of Tacopsia, which is the flagship CME of TACO, that is to have an oration by an eminent ophthalmologist and to honor our own senior members who have guided us with the Lifetime Achievement Award. TACO also believes in kindling the interest of young doctors towards ophthalmology so that our medical specialty is served by brilliant new entrants to this field. For that, we have the TACO gold medals for undergraduate students from all medical colleges in Thrissur who have topped in the finals of undergraduate ophthalmology exams, and for the postgraduate student who has topped in the MS finals of Kuhas. So with this agenda, I go to my formal task for the day. Our program will be inaugurated by Dr. Meena Chakrabarti, President KSOS. I extend a warm welcome to you, Madam, to our program. Dr. Mahesh G, Secretary KSOS, is here to offer his felicitations to the program. I welcome you, sir. Dr. Babu Krishna Kumar, President-elect KSOS, will be announcing the gold medalists. I welcome you, sir, to the program. Professor Dr. Charles Curria is our Lifetime Achievement Awardee for the day. I extend a warm welcome to you, sir. Dr. Geeta Menon has been a legend in her own lifetime. I have heard her name being mentioned with reverence ever since I came to Thrissur 23 years ago. It gives me great pleasure to welcome you, Madam, for the TACO Oration, an event to which you paved the founding stone by giving our club the unique name of TACO. I also welcome Dr. Kalyani Kuti and Dr. C.L. Anthony, who will be introducing these eminent persons to us. I welcome the gold medalists, both undergraduates and postgraduate, for achieving this remarkable feat and coming to our program. It will be remiss of me if I do not mention Dr. Rajiv Sukumaran, Scientific Committee Chairman KSOS, who conducts these virtual meets with Ilan. Welcome, sir, to Tacopsia 2020. I also welcome all our senior members and other delegates who have made time to attend our program. A warm welcome to you all. Thank you all and hope you enjoy this program. Welcome to Tacopsia 2020. Over to you, Latika. Unmute.
Thank you, Marin. So next, let me call upon our President, Dr. Meena Chakrabarti, to inaugurate the CMA formally. Madam, please.
Respected dignitaries on this virtual dais, my dear friends and colleagues, on behalf of the Kerala Society of Ophthalmic Surgeons, it gives me great pleasure to be part of the inaugural function of TACO 2020, Something Less is More, the flagship CME of the Thrissur Ophthalmic Club. I also take this opportunity to welcome the Lifetime Achievement Awardee, a very deserving Lifetime Achievement Awardee, Dr. Charles Curria, and the Oration Awardee winner, Dr. Geeta Menon, a distinguished TACOite who has made it big in the global ophthalmic scenario. I congratulate the gold medal winners and may this be an inspiration for them. From the KSOS front, we have been having weekly educational webinars. The NCD-NCED project, which is my flagship project, has been very active with webinars in the vernacular for patient awareness. We have had a school health program, which was very well attended and well participated by the students. We have posted awareness videos in our website. We have had smule songs, and I look forward to your cooperation in this aspect. It gives me great pleasure to declare this meeting as inaugurated, and I wish this meeting all success. Thank you.
Thank you, madam. Now, let us move on to felicitations by Dr. Mahesh, Secretary, General Secretary, KSOS. Please, Dr. Mahesh.
Thank you, President Dr. Meena Chakravarti, office bearers of TACO, and our chief guest, Dr. Geeta Menon, other dignitaries. It gives me great pleasure in offering in felicitation in this meeting of Tacopsia. TACO has been in the forefront of conducting academic programs over the last many years, and this time it is none other than Dr. Geeta Menon. In fact, she is the only recipient of Colonel Rangachari Award from Kerala, if I am not mistaken, with the prestigious award in the national level. So no other person better than Geeta Menon to offer this thing. After the pandemic started, the epidemic of webinars have been appreciated well by most of our members, because a lot of people who are not able to attend physically are attending our meetings. So there are flip sides and positive things with the webinar. And we are coming to the end of this webinar series this month. And we all look forward to Drishti 2020, which is literally organized by our scientific committee, Tech Wizard, Dr. Rajiv Sukumaran. And you will have a fantastic experience with Drishti 2020 virtual. I offer my best wishes to Tacopsia, and thank you, everyone.
Thank you, Dr. Mahesh, for being here with us today. Now, let's move on to the next program. That is, I invite our President-elect, Dr. Babu Krishnakumar, and our own senior member to announce the prestigious TACO Awards and Gold Medals for 2020. Sir, please.
Babu sir, no, you have to be unmuted.
Unmute. Okay, can you hear now?
Unmute.
Yes,
unmute.
yes, you can. We can hear you.
Okay, I did forgot. Respected seniors and dear friends, thank you, my dear friends at TACO, for participating me in this CME. The association between KSOS and district clubs are mutually beneficial. Tacopsia is a prestigious CME of TACO. Our scientific committee chairman, Dr. Rajiv Sukumaran, is doing an excellent job in bridging academic activities through webinars. He's participating for the success of this CME Tacopsia. He has to be congratulated. TACO, the pioneer of Ophthalmic Club of Kerala, is always in the forefront of honoring academic excellence. At KSOS, it has instituted 2 awards, one for quiz and another for best poster. At home, it is applauding the best UG students in ophthalmology from when there was only 1 medical college at Trichure. Now it has gone up to 3 UG gold medals. Recently, it has added gold medals for best PG student also. This year, the award goes like this. UG gold medalist Reshma from Calicut Medical College. From Government Medical College, Trichure. Reshma.
Reshma?
Thank you. Thank you, sir. First of all, I thank all my teachers and others who guided me to achieve this. And these kind of awards are of great inspiration for us and for also the upcoming juniors to perform their best. Finally, I thank all the members of Trichure Academic Club of Ophthalmology for this award of appreciation. Thank you.
Next is UG gold medalist Rema Thomas from Amla Institute of Medical Science. Rema.
I would like to thank the Trichure Academic Club of Ophthalmology Am I audible?
Yes,
I would like
yes.
to thank the Trishur Club of Ophthalmology for this great honor. I would also like to offer my sincere gratitude to Charles sir, Latika ma'am, and to the entire ophthalmology staff in Amla, and especially to my parents and my friends for their continuous support and guidance. Thank you so much.
Lady Gold Medalist Dennis Wilson from Jubilee Mission Medical College.
Respected
Dennis?
doctors, my teachers, and everyone. Hello.
Dennis. Dennis.
Am I audible?
Yes.
Am
yes.
I audible?
Yes, yes, Dennis, you can say.
Yes, ma'am. Respected doctors, my teachers, and everyone. I like to express my sincere thanks for giving such a memorable appreciation during this program of Tacopsia. I believe this was grace of God to get this award. I also thank my teachers, Dr. Andrew sir, Dr. Alex sir, Ronald sir, and all teachers in the ophthalmology department. Their support and valuable guidance was very much influenced by all of us. I also thank everyone in this association for giving such an inspiration for our students. Thank you, everyone.
Next is PG Gold Medalist. PG Gold Medalist Dr. Aishwarya Shashidharan from Jubilee Mission Medical College. She is the third rank holder in Kerala University of Health Sciences. My personal happiness is her father, Dr. Shashidharan, is my MBBS classmate. Aishwarya?
Very good morning, all. I'm very honored to receive this year's TACO PG Gold Medal. I wish to thank my parents and my family for their constant support. I also want to thank Dr. Andrews Kakanat and my whole department at Jubilee Mission for preparing us so well for the exams. I also want to thank TACO for arranging monthly CMEs, which was very useful for us PGs for preparing for the exams. And I also want to appreciate this initiative by TACO for encouraging us budding ophthalmologists. Thanking you all once again. Have a good day.
Dr. Charles K. Scaria, the eminent academician, is honored with Lifetime Achievement Award of TACO for 2020. I had the good fortune to work with him as General Secretary while he was President of KSOS.
Sir, the award, can you please show the award on screen?
Award on screen.
We can move on to the next because sir will be anyway acceptance speech.
Okay, and detail will be. TACO Oration Award 2020 is for TACO Oration Award for 2020 is for its prestigious member, Dr. Geeta Menon. She is a consultant ophthalmic surgeon at Framley Health NHS Foundation Trust UK. When she was in Vijayashree Hospital, I was lucky to be with her. Detailed profiles will be read out at appropriate event. Thanking you. It's okay. Latika?
Yes. Thank you so much, Babu sir, for that wonderful presentation of awards. Now we can move on to the introduction of Lifetime Achievement Awardee, Professor Dr. Charles K. Scaria, by our senior member, Dr. C.R. Anthony. Sir, please.
Hello, hello. Can you hear me?
Yes, sir. Yes, sir.
Respected senior members, colleagues, and all my friends. At the outset, I would like to thank the organizers of Tacopsia 2020 for giving me the chance to introduce a Lifetime Achievement Awardee. I am very happy and delighted to introduce a famous professor of ophthalmology. He was born in 20th of June 1952 to beloved parents, Chevalier J.V. Scaria and Dr. and baby's career. He had his schooling from St. Thomas Residential School, Kizhillam, Ernakulam district. Pre-degree from Union Christian College, Alva. Graduated from TD Medical College, Alapi in 1974. He had his senior house urgency from Christian Medical College, Vellore, 1 year in medicine. Post-graduation from Government Medical College, Trivandrum, 1981. Sir has worked as a faculty in all government medical colleges of Kerala for 27 years. Retired as Professor and HOD, Government Medical College, Trichur in 2008. He is continuing as Professor and HOD, Department of Ophthalmology, and as well as Deputy Medical Superintendent, Amala Institute of Medical Science, Trichur, from 2008 onwards. Sir is a life member of KSOS and IMA from 1981 onwards. Founder member of TACO along with Professor Dr. Mary Kuriakos Madam and Dr. Krishnankuti Sir. Served as President and Secretary of TACO. Scientific Committee Chairman KSOS for 2 years. He has enforced strict time schedule for scientific sessions during the tenure. Sir has also worked as President of KSOS, played a lead role in bringing out Kerala Journal of Ophthalmology, an indexed journal. Organized many CMEs, conferences for KSOS and TACO. Conducted many scientific sessions, presented scientific paper in Drishti. He has many publications in indexed journals. Regarding his family, his wife, Mrs. Sujata, a homemaker, daughter, Dr. Ranjana Charles, family physician, Emirates Clinic, Dubai, son, Dr. Deepak Charles, consultant hematologist, Aster Medicity, Cochin. Sir is blessed with 4 grandchildren. I had a long association with him, starting from UG level. Of course, he was senior to me, but we were in the same hostel. After my PG, I was fortunate enough to work with him under the able guidance of Professor Mary Kuriakos. He is a very good teacher, able administrator, and above all, is very loving to patients, colleagues, and students. Now, I would like to present before the august audience of Tacopsia our sweet, loving Professor Dr. Charles K. Scaria. Thank you very much.
ലതിക അൺമ്യൂട്ട് ചെയ്യാ. ലതിക അൺമ്യൂട്ട് കേട്ടില്ല.
Sir, I humbly request you to deliver your acceptance speech and also a message for the next generation of budding ophthalmologists.
Good morning, everyone. Am I audible?
Yes, sir.
TACO President Dr. Marin Paul, Secretary Dr. Ledika, KSOS President Dr. Meena Chakravarti, incoming President Dr. Babu, KSOS Scientific Committee Chairman Dr. Rajiv, TACO Oration Awardee and my friend Dr. Geeta, colleagues and my dear friends. It's customary to say only good things about a person on few occasions, like when you retire from service or when you are recognized with some awards and when you leave the world forever. Thank you, Anthony, for those nice words. He's a good friend of mine who fits in with the saying, a friend in need is a friend indeed. Let me recollect 2 instances. Few years ago, when I was writhing in pain due to the ureteric colic in the midnight, it was Dr. Anthony who took me to the Westport Hospital and gave me the necessary, arranged for giving the necessary treatment. Later, there was a person who was entrusted as security in my house when I went to my native place. He was a juvenile diabetic and went into hypoglycemia and got locked up inside my consulting waiting area. Anthony, with the assistance of my neighbor, undertook a rescue mission and saved it. Thank you, Anthony, once again. Lifetime Achievement Awards are given by various organizations to recognize significant achievements during one's lifetime. But TACO and our parent organizations like KSOS and AOS give Lifetime Achievement Awards not only based on achievements, but also based on contributions to the organization and based on seniority. Whatever may be the criteria of my selection for this award, it is indeed a great honor to be recognized at the fag end of one's career. I am humbled, honored, and stand before you with great emotion and happiness. This is one of the most significant events of my professional career. I thank the President, the Secretary, Executive Committee members, and members of TACO for this wonderful honor. As I look back over the last 40 years of my career, I realize how little I would have been able to accomplish had it been all by myself, without the support of my parents, teachers, colleagues, friends, and my family. I'm grateful to my loving parents who are responsible for me taking up this profession and who navigated and supported me all through my life. I'm grateful to my teachers who believed me, planted seeds, cultivated them, and satisfied my thirst for knowledge. One name stands out among all my teachers, and that's my beloved professor, late Dr. K.S. Subramanian. During my postgraduate course in Government Ophthalmic Hospital, Trivandrum, way back in 1977 to 79, when I got appointment in the medical college service and government health service simultaneously, it was Dr. Subramanian who identified the teacher in me and advised me to take up the teaching profession. Later on, while working in Government Medical College, Thrissur, I had the great opportunity to work as assistant professor along with Professor Mary Kyriakos for long 14 years. I learned the art of diplomatic administration and organizational skills from ma'am. During that period, I had the fortune to work with another doyen in ophthalmology, Professor Alex Joseph, who was again a great administrator, organizer, and a surgeon par excellence. I will remember with gratitude all through my life the unconditional help and support given by him in times of need. I'm thankful to my colleagues, members of TACO, friends, and students who supported me throughout my career. I'm also grateful to my many thousands of patients I had the pleasure and privilege to serve life. Last but not the least, I'm grateful to my loving wife, Suja, the wonderful person who stood by me through thick and thin all these years. My children, Dr. Ranjana and Dr. Deepak, through their feedbacks as medical students, played a prominent role in redefining the teacher in me and improving the teacher-student relationship. When Latia informed me about being selected for the Lifetime Achievement Award, the doubt in my mind was, what is my contribution to ophthalmology and am I worthy to receive this award? Well, I was a founder member of TACO and later on the secretary and then the president of TACO and organized many continuing medical education programs under the banner of TACO. I remember organizing the first ever live surgical ophthalmic CME in Kerala almost 30 years ago by the Department of Ophthalmology Medical College, Thrissur, in association with TACO. As a scientific committee chairman and president of KSOS, I have contributed significantly to the development of the association. As the president of KSOS, it was my perseverance and pressure which resulted in upgradation of Kerala Journal of Ophthalmology as an index journal. I was very actively involved in organizing Drishti conference in Thrissur many times. On the academic side, assessing the feedback from my students, I think I have done reasonable justice with my teaching at both undergraduate and postgraduate level. Played a lead role as head of the department in setting up the ophthalmology department at Modamanuthukavu and starting the postgraduate course there. While working as HOD at Kozhikode Medical College, with the active cooperation of my colleagues there, we could improve the quality of academics and upgrade the infrastructure, which helped a long way to boost the sagging image of that department at that time. Also played a frontline role in starting the postgraduate course at Amala Institute of Medical Sciences, Thrissur. I know time is precious, but I request a couple of minutes more of your valuable time as the secretary requested me to give some message to the younger generation. My advice to the young generation is that as our world and ophthalmology advances at lightning speed, please take some time to slow down, to analyze the meaning and purpose of your profession. Take time to get involved in whatever way capacity you can to help the underprivileged and the differently abled. Doctor-patient relationship is one of the most unique and privileged relationships probably next to mother-child bond. Of late, some disturbing and unhealthy trends are evident in the doctor-patient relationship, which is unhealthy both for the profession and the patient. The introduction of technology, institutional and group practices have affected the individual doctor-patient relationship. What can be done to maintain the healthy doctor-patient relationship? To my mind, it is the ethical behavior, both on the part of the doctor as well as the patient, which should govern this very pleasant and fruitful relationship. You should practice upholding high moral values and following full code of medical ethics. Don't run after fame and money. It will come to you in due course with dedicated hard work. Always receive your patient with a pleasant, warm smile. I have watched with amazing admiration some colleagues in our profession receiving their first patient early in the morning and to the last patient late in the evening with a pleasant and warm, receptive smile. At this juncture, let me recall an incident which happened in my private practice during the early days of my career. A sannyasi belonging to ISKCON group came for consultation and had 2 or 3 reviews and fully recovered from his disease and was happy and satisfied. After the last visit, when he was leaving, he made a comment. Your attitude, approach, service is well appreciated. Your patients will be much more satisfied and happy, and you will get more patients if you give a warm smile to your patients. However hard I tried, that smile is still lacking in me. Listening to the patient is very important, even if the diagnosis is written on his face. Find time and be patient enough to hear all their complaints, however silly it is. Communication is the key to success. You have to cultivate the art of communication skills to survive and succeed in this profession. Communication gap is the main cause of majority of consumer litigations. After examination of the patient, spend some time communicating with the patient about the management protocol, probable outcomes, and possible complications. Although the truth may be traumatic, the disclosure of the truth need not be always traumatic. Do not take the hope away from the patient under any circumstances. And if possible, try to cheer up the patient with some sense of humor when everything looks bleak and dark. Refer the patient to a trusted colleague in time, and you should never sit on prestige and ego to hold the patient for longer than needed. Maintain a good harmonious relationship among our fraternity, supporting each other in the hour of crisis. Don't ever make open, critical, sarcastic comments, especially in front of the patients and relatives. Even if something has gone wrong, in my personal experience, taking the patient and relatives into confidence would help in most circumstances unless there is an ulterior motive. Documentation is very crucial and often is a saving grace for the practitioner under some kind of blame. The consent taken for any procedure should not be a mere formality, but should be obtained after explaining fully to the patient and relatives in their language and at their own level. Some patients do enough research on the internet to understand a particular disease, sometimes better than the treating doctor, causing discomfort to the doctor. So wake up, colleagues, and get updated on new diseases and latest treatment protocols. I'm not young as I used to be, but I still love what I do and see no reason to stop my profession anytime soon. Even during this alarming community spread of COVID-19 happening these few days, 5 to 6 patients above the age of 90, 95 years, who was operated by me 20 to 30 years ago, came for consultation. The respect they give, their faith and confidence in me, the happiness and satisfaction they express are the driving force to continue in this profession during this difficult period. I hope to work for another few years or as long as I feel I can contribute to the patients and the students. Thanking you all once again for this wonderful honor, which will be cherished all through my life. Thank you again.
Thank you so much, sir, for that unparalleled pearls of wisdom that you shared with us, which I'm sure nobody here will be able to access or assimilate from any other source. It was really a tremendous wealth of information and ethical attitude that you shared with us. Thank you so much. And actually, TACO is honored to honor you with this Lifetime Achievement Award because you are without doubt one of the most illustrious and inspirational figures, not only in TACO, but in the entire state. I am personally privileged to have been associated with you professionally for all these years. And I stand testimony to every word that you said just now. You are somebody who is putting each of this word into practice, and I am honored to learn by seeing you do all this each day for so many years now. So thank you so much, sir, for those enlightening words. And now I think we can move on to the next program, that is, may I call upon Kalyani Kuti Madam now to introduce our TACO Oration Awardee, the legendary Dr. Geeta Menon.
Respected KSOS President Meena Madam, Scientific Committee Chairman Dr. Rajiv, TACO President Dr. Marine, Secretary Dr. Ledika, and other dignitaries and friends. Thank you very much for giving me this opportunity. I have immense pleasure in introducing Professor Dr. Geeta Menon, an eminent personality in the field of ophthalmology and who also happens to be my friend. We TACOists are proud to say that Dr. Geeta was the person who named TACO, which was originally TROC. Coming to the educational and academic accomplishments of Dr. Geeta, time to narrate all of them. Dr. Geeta was born and brought up in Ahmedabad, and she completed her school education in a convent and then joined medical college in Ahmedabad. When she was in her third year of MBBS, she resolved to take ophthalmology. And after finishing her MS, she got married and arrived in Thrissur. My acquaintance with Geeta begins in 1985 when she joined Vijayasree Eye Hospital, where she worked for 10 years. In between, she went for Retina Fellowship under Dr. P. Nagpal. And she was doing many retinal surgeries at that time, not only in Thrissur, but also in Shankara Eye Foundation, Coimbatore. One of the lingering memories that I have is our trip to Delhi for AIOS conference from Vijayasree. And Dr. Geeta was the recipient of Colonel Rangachari Award at that time. And thank you, Dr. Ledika, once more for this reunion after many years. In 1995, she started her career in UK. From then, the graph climbed to greater heights steadily. Presently, Dr. Geeta is a consultant ophthalmic surgeon at Frimley Health National Health Service Foundation Trust in Surrey. Her major fields of interest are medical retina, especially novel treatment for age-related macular degeneration, and cataract. She heads the Regional Referral Center at Frimley for macular diseases, and she has designed and established a mobile macular unit. She was appointed Director of Medical Education at Frimley Health in 2014. In the inaugural post as Head of School of Ophthalmology, since 2011, she had set schools at Kent, Surrey, and Sussex. She is also a visiting professor at University of Surrey. In 2016, Dr. Geeta was elected as Fellow of Royal College of Physicians and won the National Institute of Health Research Award for excellent research leadership in NHS that year itself. She was also awarded prestigious Gold Clinical Excellence Award for contributions to UK National Health Service over and above her routine clinical practice in 2016. In 2017, she became the recipient of Excellence in Patient Care Award hosted by Royal College of Physicians. Dr. Geeta was the section editor of Medical Retina of Eye Journal, which is the flagship journal of the Royal College of Ophthalmologists. She has published more than 50 papers in high-impact journals. Her mobile macula unit won the award for Best Example of Efficiencies at the prestigious Building Better Healthcare Awards. She has been appointed Postgraduate Dean for Health Education England across South London in 2018, and she has been the guest speaker in many AIOS conferences. Personally, Dr. Geeta is an outspoken and very friendly person. And she is married to Dr. Ravindran, working as radiologist. Her son Prashant is also radiologist, working in UK itself. And she has got a grandson. And I wish her all the very best in her journey to finer accomplishments, both in her personal and professional capacities. With these words, I welcome Dr. Geeta.
Thank you, Kalyanikuti Madam, for that very endearing and endearing introduction to Madam Geeta Madam. Geeta Madam, now I invite you for the much awaited oration on being a leader and living the dream.
Thank you very much. I think I feel like an imposter sometimes sitting here, and wondering whether I really, like Dr. Charles said, whether we deserve all of this. But anyway, for me, this has been a great, great pleasure because like Kallu said, Kallu's Elizabeth and I, we've been in Trichur and we actually have very fond memories. And so to come and talk at TACO is actually a really humbling request. So thank you. I want to thank all of you, first of all, for inviting me. So Merin, Latika, Babu, everybody. So I'm just going to now share my slides. I hope it works. I hope everybody can see that. So I was asked to actually talk about my journey and my leadership journey as well. So I called it being a leader and living the dream, because that's what I feel it is. Abdul Kalam once said, dreams are not what you get when you sleep, but true dreams are ones that don't let you sleep. So I firstly wanted to start off by actually, busting some of the leadership myths that we all have. The fact that leaders are born and not created. You need charisma to be a leader. You need to be an extrovert to be a leader. I don't think any of that is true. Because what good, effective leadership is a skill that can be learned, practiced, and improved upon. We tend to notice the more obvious charismatic leaders with loud, bold personalities, but not all of them are great leaders. So if, Hitler comes to mind, I mean, he was a leader. He had a whole host of followers, but that's not great, is it? Similarly, it's sometimes the quietest person in your group who hardly speaks a word, who then turns out to be the prime minister of a country and things like that. So I think it's important to remember that good effective leadership is actually a skill that you can actually learn. In fact, it's highly likely that in some point in your life, everyone is called to be a leader or lead in some capacity. So going back to my journey, so Kalluz has already said some of it. So like she said, I was born and brought up in Ahmedabad, and I moved to, I got married while I was doing my MS. It was an arranged marriage. And at the end, when I finished my MS, I moved to Kerala. I must say it was quite a change for me coming from Ahmedabad, where, you know, I had all the freedom to move around, and moving to Kerala. And it was always, you know, at the back of your mind, you worry about, I had been given absolute freedom with my parents, and they were always supportive in everything I did. And was that going to be the same? I was really lucky, and I am really lucky, I must say, because my in-laws, Ravi's parents, were absolutely the same as mine. They encouraged me every step of the way. And I think that support that you get from your family is really, really important in every bit of your journey. So after moving to Kerala, so I already had a 3-month-old baby, and Prashant, and I remember coming in there, my mother-in-law, she's a doctor as well. And she was friends with Dr. Vijay Lakshmi. So she said to me, when you come here, don't worry, we'll try and find some, you know, way that you can work at Vijay Shri Eye Hospital. So I think it was about a few weeks after I came in to Thrissur that Vijay Lakshmi madam came to our house. And I remember my mother-in-law asking her, is there any way that Geeta can come and work at Vijay Shri? And Vijay Lakshmi madam, in her absolutely usual way, she just smiled at my mother-in-law and she said, there's no, but it doesn't matter. Let her come and we will find place for her. I'm in my room. She can sit in my room. I'll create the place and then she can come and work with us. And lo and behold, 2 weeks down the line, I was actually working at Vijay Shri. And then I met all these great friends of mine, Kalluz and Elizabeth and all of them. And I think that really was a great place to work because you had lots of patients, lots of surgery, etc. So then one day I was in the clinic and we had a patient with a retinal detachment. So as was the tradition, I took it to Krishnamurti sir and I said, sir, this patient has got a retinal detachment. So what should we do? And in those days, there wasn't any place where they were doing detachment surgery except sending them to Madurai, Arvind Eye Hospital. So Krishnamurti sir looked at me and he said, Geeta, I don't think this patient is going to go because, you know, they can't afford to go to all the way to Madurai. So the chances are you will say you go there, they will go home and they will not go anywhere. And then next time they will be blind in that eye because they wouldn't have done anything. Why don't we actually try and do this over here? I mean, you know, we've got the cryo machine. So let's actually try and seal that hole. We can see the hole very clearly and see if we can buckle it. I remember 2 hours down the line after moving the bucket 3 times and, you know, trying to use the direct ophthalmoscope to do most of the surgery, we came out of theater. Luckily, the patient did really well. And, you know, we managed to actually seal the hole. He said to me, you know what, Geeta, I think you need to go and do a fellowship in retinal surgery. We don't have anybody here at the moment. And it's really important we actually give that service to our patients. So that's how 6 months after I landed in Thrissur, I decided to try and look at going to do a vitreoretinal fellowship. Now there's an interesting story behind this as well. So whilst I was doing my MS, I had gone to the Gujarat Ophthalmology Congress to present a paper. And it was on corneal melting syndrome and how we had used cyclophosphamide to treat that patient. And it won the gold medal at that conference. And at that time, Professor Nagpal was there at the conference. So he came to me and he said, oh, looks like you're doing your MS. You've got a year more to finish. Why don't you come and do a retinal fellowship with us after that? At that time, I had just got married I was pregnant, and I said, no, I'm not interested in retinal surgery. I want to go back to Kerala. That's where my husband is. So when sir asked me to do this, I sent my dad. I said, Acha, go and talk to Dr. Nagpal, Professor Nagpal, and see whether he's actually got a space for me to do the fellowship. And of course, what did Professor Nagpal say? He said, Mr. Menon, I actually offered your daughter this fellowship a year ago, and she said she wasn't interested. I'm really sorry. We've got a waiting list at the moment. So you'll have to wait for 6 years for her to come here and do it. So Krishnamurti sir, you know how he is. He never gives up. So he basically said, let's write to him. Let's write to him and say that this is the situation. Our patients are going blind. They don't have the money to go elsewhere. So, you know, so he wrote a letter to Professor Nagpal, and then Professor Nagpal said, okay, fine. If anybody drops out, then usually we have a waiting list, but I will actually slot her in. And so in 89 June, he called up to say, we've got a vacant spot here, so why don't you come over? And so that's how I went and did my retinal fellowship with Professor Nagpal. I tell you, it was a great, great experience. It was really hard. And again, I had my parents supporting me because I took my 1-year-old son back with me while I was doing the fellowship. I had amazing husband who basically allowed me to go, you know, for 6 months. And then came back to Thrissur and started doing retinal surgery. We also had lovely atmosphere at Vijayashree, where sir was always, Krishnamurti sir was always actually trying to do new things, invent things, and he was a real innovator. So as a part of that journey, Kallu's Elizabeth and I, we used to go and present a lot of papers at conferences. And we were actually reminiscing yesterday how we used to meet at Elizabeth's house and sit down and write abstracts for these conferences at AIOS and come up with all these fancy titles for it. And then even practice our presentations, because, you know, it was not a done thing that lots of people from South India going to AIOS in those days. And I remember Elizabeth telling me that, you know, yesterday that her 4-year-old son Ashwin used to be the projector manager in the scene, because we used to have slides and projector in those days. So yeah, life was great. I mean, I thought I was living the dream then, you know, having a great job, you know, and doing all the fun that I was having. I was also lucky because Professor Mary Kuriakos at that time was at Thrissur Medical College, and I used to actually go to help her with retinal detachment surgery, etc. So I thought this was my dream, you know. And then what happened was that in 1985, like Kallu said, a lot of things happened together. Had a bit of a tragedy in my life when I lost my baby, and at the same time, my brother, who was in the UK, kept pestering me to come. My professor, Abhay Vasavada, used to keep saying, you know, come over, go to the UK and, you know, do your fellowship. So Mary Madam had actually gone to do a Commonwealth Fellowship in the UK. And so she said that she was in touch with the consultant who she had worked with, and he had suggested that, you know, if she knew anybody who could come over to the UK, because there was a double sponsorship scheme going on at that time, where, you know, Mary Madam could sponsor me to go to the UK, and then the consultant would sponsor me to the Royal College of Ophthalmologists. So I didn't have to take any PLAB exams or anything. And that's how it worked out. So, you know, Mary Madam sponsored me to go, and in 95, I made the journey to the UK. So I came into this country, and from being a consultant vitreoretinal surgeon, I was back to being a senior house officer, which is like, you know, somebody in the first level of training, your first year of post-graduation here in this country. 6 months down the line, they made me a registrar, which is the next level up. Interestingly, I mean, you know, it was hard. Of course, it was hard when you used to do the retinal detachment surgeries, and now you were actually pouring water on the cornea when the detachment surgery was being done by somebody else. But you know what? It was my decision to actually make that journey. So, you know, I was just, you know, learning the skills, understanding how working in the NHS was, which was very different from what we were used to. then in 97, whilst I was in the training program, I had to make a decision. So I was given the vitreoretinal fellowship with Professor David Wong, and he's a very famous VR surgeon in the northern part of England. And I also had a middle grade job that came up at Frimley. And I remember really thinking about this. My husband was working in London at that time. So me going off to Liverpool, which is, in the northern part with my son, it was not a great idea. So I decided to actually come out of training and take a middle grade job, which was basically a, what is called a staff grade job in those days. I remember my brother didn't talk to me for a whole week because he thought I was making the wrong decision. But I felt that I needed to give my son that stability at that time of, being in, because he was going to go into secondary school, and it was really important. I had taken my fellowship exams by then. So I came to Frimley as a staff grade doctor. So, Frimley was a great place to work, is a great place to work actually. And in 1999, then my consultant colleagues, so the consultant is the highest post in the NHS. So my consultant colleagues called me in and they said, you know what, Geeta, I don't think that you're working to your potential here. I think you should actually go back into training and then go and become a consultant. And I was like, no, I'm not really interested. I'm actually very settled in this job. And, this is what life is, isn't it? When you're in your comfort zone, you do not want to get out of it. So during that period, I set up the macular service at Frimley, even though I was only a staff grade doctor. But in 2002, my consultant colleagues were very persistent. They brought me back. I call it to the headmaster's office because they were all 4 male consultants. And they said, look, Geeta, we really, really want you to progress. This is not you've done so much more. You got more experience than, some of us here. So why don't you apply for what is called equivalence training? So what they do is that you look at all your training that you've done in India and then see whether that is equal to the training that has been available in the UK. And if they think that is right, then they actually give you they put your name on the specialist register. So which means that you actually then can apply for a consultant job. And they also gave me the job of a locum consultant. So I applied for equivalence training in 2003. And in those days, the Royal College always used to find a reason for not giving you equivalence by saying you need to do X amount of more training and this and that. But I was just lucky, I think, that, all my training that I had done was equal. And so I then got a substantive consultant job in 2004. So yeah, I think then my passion besides ophthalmology is research, as you would have guessed, and education. And so I, do a lot of research, and like Kalu said, I've done a lot of bits in education, and being the director of medical education means that you're looking after all the trainees, not just ophthalmology at Frimley. Then I set up the School of Ophthalmology in 2011, and and currently, and I'm also the clinical director for research with the National Institute of Health Research, which is a clinical research network in our region, which is Kent, Surrey, and Sussex. So it's been a great life. I've also actually done a lot of global work, and this is something that I really, really enjoy. So Vision 2020 is a program that is run by the London School of Hygiene and Tropical Medicine, which actually connects places in the UK to places in Africa. And so we were linked to Zambia. And what I did over there was, when we went there for the first time for what we call a scoping visit, we found that patients were going blind because they used to come very late to the hospital with diabetic retinopathy, and most of them requiring vitreoretinal surgery, and it was just too late to save their eyes. So what I did was set up what was called diabetic retinopathy screening. So we did capacity building. We trained people who were high school dropouts into taking pictures of the patients' retinas, and then train them to grade the images, and also trained at the ophthalmologist to do laser treatment and others. So this is what we used to do at screening. So we'd have run camps, so patients would come in. They had a mobile unit. We developed a mobile unit with a camera on it, so it would go to the different places, and the patients would know that the program was coming there. They would get registered. They would have their blood tests and blood pressure, etc. done. Then they would have their vision tested, dilate drops, and picture taken. The image would be graded. All this would happen at the same time on the same day, because in Africa, if you send a patient back without giving them the idea that they need to come back for treatment, they wouldn't come. So, it was quite a journey. And I think that it has been great now, because I feel this is one of the things that I've really enjoyed doing, because I feel that I have actually helped in reducing blindness in some of the countries in Africa. And so, and then they can go back to the base hospital. So the base hospital, I managed to work with the Ministry of Health in Zambia to get them equipment for fluorescein angiogram machines and OCT machines. And, so then they actually have their intervention. They come into the base hospital for laser treatment, or they have Avastin injections in Zambia, and or vitrectomy is available as well. So, but I just wanted to highlight that, often you feel that a leader's journey is always all about success, but that's not the case. You do have come across failures in your journey, and it's about how you actually talk about those failures and how you learn lessons from those failures. So in 2018, I went for a role in education, and as usual, I thought I'd ace the interview, and I came back thinking, yeah, things are going to be great. And then I get a phone call saying, no, we're sorry to say that you were overqualified for that role, and I didn't get it. And I remember, ringing my mother up and saying, oh no, I didn't get that role, etc. But interestingly, a few weeks down the line, there was a role that came out for the postgraduate dean for South London, which was much bigger role. I went for that and I got it. And I therefore remember this phrase that somebody said, that rejection is often redirection. When you get rejected for something, or when you have a failure, it sometimes really pulls you down. But actually being a leader is about learning from that failure and moving on. And in fact, it's true, because the postgraduate dean role has allowed me to do so much more in education than the other role would have done. So it is hard sometimes, and you find yourself worrying about, again, that imposter syndrome that I was talking about, which is, am I right? Was I right? Am I really good enough for all of this? But it's just getting back on the horse again, like the Englishman say. So what is it that we need? What you need is grit, okay? And I talk about grit, it's about the passion and perseverance for long-term goals. And I would really advise you to see the TED talk, TED talk that Duxon gives, which is about why grit is important. And grit actually allows you to stick with your future and working really hard to make that future a reality. So, and the other thing to remember about leadership is not about your title. It's actually about your behaviors. And I love this, this thing about whoness and whatness. So who I am is actually defined by the fact that I am Geeta, I'm an ophthalmologist, I'm a mother, wife, daughter, sister, and a grandmother. Yeah, that's who I am. And my who-ness should not be dictated by what I am. What I am is actually, being the postgraduate dean or being a great researcher, etc. Because when you find that your whatness dictates who you are, then when that whatness disappears, then your who-ness actually goes down. So that's why it's important to think about, whenever you think about whatness, your who-ness should be that filter to make you decide what you want to do with things. So I often get asked, you see, why is it that, how is it you decide that you want to take on these roles? Yeah. And that's what I tell my teams. I say that, you know, if you're taking on a role because you actually are passionate. So always remember, the who-ness is what is actually dictates your life, not the whatness. The other thing about leadership, I really believe, is authenticity. Being an authentic person really helps you be a really good leader. And when I mean authentic, what I mean is that you actually are taking your whole self to work. Every bit of you, you're not leaving things behind. Your failure is a part of you. Don't orphan that. Similarly, you know, I am Indian. I am not trying to, I'm not going to be changing my accent. I am not actually, you know, going to dress differently because I want to prove that I'm actually one of the crowd and, you know, back in that space. I am not going to do that, because that if I do that, then my team will never know who the real me is. And that means that they would find it really hard to trust me. So to be an authentic leader is about that. And I still remember my son was 7 when we came here. And one day he comes up to me and he says, "Amma, you know, you look very smart in your suits, but you look like my mother when you wear a sari." So I said to him, it was winter at that time. I said, "Monu, I can't wear a sari now. It's too cold. But in the summer, I always wear saris to work. And it doesn't matter. You know, people, I remember my friends telling me, how can you wear a sari to work? They will know that you're an Indian. I said, I'm not going to paint my face white. They will know I'm an Indian. I'm always an Indian at heart. And my patients love it. They actually say, you know, "Prof, where's your sari? Why are you wearing this boring suit if it's a sunny day?" And they even asked me the question about, you know, do you get woolen saris in India? No, you don't get woolen saris in India. So yeah, so I think it's jokes apart, it's about taking your whole self to work, making sure that every part of you is visible to your team so that they then can trust you. So trust is really, really important. When you're actually trying to get your team to actually follow and go along with you in your journey, then they need to have authenticity. That is, they are experiencing the real you. They need to understand that, you know, you're logical with your reasoning, but at the same time, you have the courage to tell them that you don't have all the answers, that this is a journey where we'll be finding those answers with everybody in the team. And the last, but not the least, is about they need to believe you care about them. Okay. And that empathy is so important, like Dr. Charles was saying in his thing as well, you know, having that kind of caring attitude. Those are the things that help you build trust with your team. And once you have that trust in your team, then you've really won half the game. So again, just about the 4 distinctions of trust. I love this infographic. It's about sincerity. It's about reliability. Yeah, that, you know, you will actually meet your commitments. They want to see a leader who's a complete finisher, somebody who's a role model. Competence. You need to have that ability to do what you're doing or the purpose to do it, and you know you will reach that goal. And last but not the least, like I said, you're caring about other people's interests in mind, making sure that, you know, they know that you care for them. In the journey of leadership, over in here, one of the other things that you always face, so you're a woman and you're also a woman from a Black, Asian, minority ethnic background. So it's, you know how hard it has been in your leadership journey. So therefore, it's really important that you actually make sure that other people are included, and feel belonged. And I love dancing. So that's why I have taken this example. You know, diversity is about being invited to the party. Inclusion is being asked to dance, but, you know, belonging is actually dancing and not worrying about what other people think about you. And that is what creates that sense of psychological and cultural safety, because you're making every person in your team belong to that team. Nobody is different. And that actually helps you create that spirit of that team work. I don't know if any of you have read this book called Good to Great. And this is a very small book by Jim Collins, and it's only 40 pages or so. And he talks about the journey of, how do you actually go from good to great? So he talks about disciplined people, which is the first thing. And in that, he talks about level 5 leadership. Now, leaders are all, ambitious, but what they need to be ambitious about is not about themselves, but about the cause, about the organization that they're trying to actually work with. And that is to be done with humility as well as professionalism. So that's one of the important things of being disciplined people. The second thing about the disciplined people is about first who. You need to get all the right people on the bus. So, when you're designing your team, you need to make sure you have all the right people in there to help you to go forward in that journey. The next thing is about the disciplined thought. So, you have the Stockdale paradox he talks about, which is unwavering faith in what you're trying to do. Because if you don't have faith in what you're trying to do, then you're not going to be able to get your team around you. And he talks about the hedgehog concept, which can work for organizations and for yourself as well, is about what are you most passionate about? Remember what I said, when you're taking on a role, that's one of the questions you ask yourself. What are you passionate about? What is it that you can actually contribute to that passion? And what are you best at? And then you talk about the brand or your resource engine. So that's the hedgehog concept. So that's about the disciplined thought. And then you have disciplined action. So I don't know how many of you know what a flywheel is. It's usually there in machinery, where you start rotating the flywheel and it keeps rotating and rotating until it reaches a space where the rotations actually bring that impact. Yeah. So when you start off in trying to do something in your research, in your leadership journey, it's like pushing that flywheel. And in the beginning, it's really, really hard to get everybody on board, making sure that they know what your vision is and where you're going. But as that flywheel starts rotating faster and faster, and people see that you're actually making a success of something, then there'll be a lot more people who will come and put their shoulder to that flywheel and push it along and help you push it along. So that's what he talks about in disciplined action. So you must remember that, I love this quote from Steve Jobs, he says, your work is going to fill a large part of your life. And that's why you need to keep finding that great piece of work that you love doing. And if you haven't found it, you need to keep going, because you shouldn't settle for anything less. And you will know when you find that right space where you want to be. Again, like I said, your leadership journey, you want it to be a straight line, Unfortunately, that is not the case. It's a rocky ride. There'll be ups and downs. And in fact, where there's little bit of water is there, you might even have alligators trying to pull you down. It's about actually then having that grit that I talked about, that passion and perseverance, knowing that you want to get there, whatever be the matter. That's important. I think it's also important to remember, you need to be kind and be a giver, relentlessly positive, so that, your team know that you will build and deliver stunning results despite everything, despite all those alligators trying to pull you down. It's so important to say thank you, send handwritten notes, and celebrating success like we did this morning. I mean, celebrating success of all those people, all those, young undergraduates and postgraduates, however small. You need to encourage people and big up on their strengths, because, all of us have it in us where we are all actually having that bit of imposter syndrome. Am I good enough to do this? And that's why you need to support, coach, deliver, and finish and get things done. This is, this is just kind of me being me. Like Kalyani Kudi said, I like to do things, make your goals, dream your dreams, start walking forward, and just don't wait. Do it at that time. Opportunity, when it knocks, you must take hold of it with both hands. So these are the 10 things, simple things that fab leaders do. It's a nice infographic, isn't it? So always introduce yourself. Less talking, more listening. You need to enable and empower other people and encourage them to learn from their mistakes. You absolutely need to live the values. Need to be accessible. When I mean accessible, when you are actually, say, in a clinic, yeah, and if your door is shut, then nobody is going to come and ask you questions, yeah. So being accessible, having an open door policy, making sure that anybody can come and talk to you at any time. They text you and you'll message them back. Give credit and thanks. Remain positive. And I'll tell you a little story later on about that. Welcome challenge. But at the same time, you also need to remember that you have to let your team do the work. And you need to know that you need to trust the team, that they will come to you when they need you. And instead of just standing on their head and trying to do that. And you need to remember that you're still learning and you're still developing. There's lots more to do. Again, this is another thing that's important. Don't let the noise of other people's opinion drown out your inner voice. Yeah, you need to follow your heart and your intuition. And that's when you actually get your dream and make it a reality. Success is liking yourself, liking what you do, and liking how you do it. And I say this many times a day, where you want to actually be in a job, in a place where you wake up every day in the morning and you really love going into work. You don't want to be in a situation where you've taken on all these things and you're getting up in the morning and thinking, oh no, I have to go into work. So that's what you need to have in life. So just a few pointers. Be true to yourself, appreciate and value others, be humble. Good, effective leadership is a skill that can be learned, and hard work always pays off. Be humble. That's interesting because, whenever I ring my mother up and I tell her about some achievement or something I have done, the first and foremost sentence she'll tell me is, don't be proud, be really humble. And I think that is so important. It's important that, you have that humility, but doesn't mean that then you actually are somebody who can be stomped upon. But you need that humility as a part of being a leader. Thank you very much. I'll just stop sharing.
Thank you. Thank you, Geeta madam. That fantastic talk was all that it promised to be and more also. So I'm sure it was so inspirational that it will surely help people who don't have a dream dare to dream, and people who have a dream try to forge their paths ahead, and people who have forgotten their dreams maybe try to rekindle their dreams. So your talk and your words have helped us all in multiple or many faceted ways. Thank you so much, madam. And now I think we will go into the more interesting and more, not the more interesting, maybe the interesting part or the much awaited part of interaction, actually interaction with a global leader, which we don't really get to do very often. So maybe we should go now into audience interaction. So we have representative leaders taking on this audience interaction today. So we start with a senior faculty, our very respected Dr. Alex sir, who has been also very familiar with you when you were here in Thrissur all those decades back. So I think Alex sir is the best person to start with. Sir, if you're ready, we can start our audience interaction. Sir, can you unmute yourself, please?
Yes, am I audible?
Yes, sir, you are audible.
Audible.
And I
Okay,
think
okay.
we are actually 10 minutes ahead of time, so it need not be a rapid fire question answer thing. Both the madam and sir can take their time.
Thank you. A very good morning. Dr. Geeta, congratulations for your informative and interesting talk. It is a real insight message and encouraging for the TACO members. Congratulations and thank. Now my question one, in your opinion, which is the ideal quality of a leader?
I think, like I said, humility. Yeah.
Good,
I think
good.
that's really, really important. Like Mahatma Gandhi said, no, it is unwise to be too sure of one's own wisdom. Yeah. So that's where, humility really is important. I think authenticity is important, recognizing that, I don't have all the right answers. Actually, and actually accepting that and letting the teams know that you work with that, you don't have all the right answers. We'll get there in the end together. And the last but not the least is about valuing others, always valuing all the people around you.
Okay, my next question, how a leader should bring up the next generation of leaders for smooth transition? I know in British system it is very important.
Yeah. So I think they have now tried to bring leadership training into every part of the curriculum, and starting from undergraduate to postgraduate degrees. But I think that as teachers, what we need to do is role modeling. So we need to show them that we are living the values. If I want that my team are punctual, then I need to come on time to work. If they see that kind of role modeling, then that's what they emulate. Because if you think back, that's what we have done. So, we didn't actually go on leadership courses or know how to become a leader or anything like that. But we used to actually look at what our professors did, our teachers did, and we tried to emulate them. And that's why it's important that as a role model, as a teacher, you actually show those values, that you're living those values that you talk about, the humility, the authenticity, the valuing the others, making sure you're appreciating what they do, etc. The other thing that I think is really important to mentor the next line of leaders is something called sponsorship. So basically you have coaching, which is where the person talks to you, mentoring, where the person talks with you, and sponsorship is about talking about people when they are not there, so that you are helping them move in that journey. Okay, so it's about saying that, so is really, really good in this area. So therefore, when something really good comes up, that person is remembering that, you can actually, and that is a really great leadership trait. And that is what I was talking about, the level 5 leadership, where people actually are allowing others to grow, which doesn't happen very often. That's where we need to change. We need to have that thing, we are allowing people around us to grow. It is not about that if you are at that position of leadership, you don't want anybody else coming in that position. That is wrong. You allowing everybody to grow, so that you have all these people around you and spotting that talent, spotting that person who's really good. Like, Charles sir was saying, that his professor spotted in him that he's a great teacher and gave him that opportunity. My consultant colleagues, they spotted that in me and they allowed me to grow. They didn't need to do that. They really didn't need to do that. So I think that's really important, to actually get those people around you to grow in that space.
Very good, very good. Now, my third question, how a leader should motivate his team?
Yeah, I think that it's really, really important. And it's a great question, actually. So for me, it's important to have the communication right. And like I said, when you're sitting down with your teams, it's more about listening to them. Michael West calls it listening with fascination. That is understanding what they're trying to tell you. That's really important. The other thing is having that positivity in your team. Now, let me tell you a little story. So when I was appointed postgraduate dean for South London, so I was going into a region where I'd never worked before, because I come from Kent, Surrey and Sussex. And I was going into a team who I'd never met before either. And they were actually going through what is called a consultation. That is, they were going to have changes in their organizational structure, etc. So they were not in a great place. So I was, being brought into this team, which was not sure how I was going to react to them. And, and so I remember, so I know all about cricket as a game, okay, because I grew up with a cricket crazy father and brothers, and so I had no choice. I had to actually learn everything about cricket and even play the game, but I know nothing about football. And in England, football is a craze, as you know. So they were having what was called a sweepstakes for football because the World Cup was coming on. And I remember them asking you to pick two teams. So I picked Senegal and France. I picked France and I told them France is going to win the match. They just laughed at me. They said, what do you know about these teams? I said, nothing, but I have picked it. And I'm positive. My positivity is going to make France win. And they said, oh, no, it's not going to happen. France last won in 1988. You're not going to win that. Of course, France won the World Cup. Yeah. The next time round sweepstakes, we had what is called in Britain, Great British Bake Off. And I picked the winner, David. And I said the same thing. So now my team actually has got that spirit of positivity in them now. We call it keeping relentlessly positive against all odds. And it's great because, even if one person in the team is feeling down, the other person is able to pull them up. So creating that atmosphere of positivity is really important. Next, like I said, creating that atmosphere of psychological safety and cultural safety that they can come and talk to you if they make mistakes. Because, if you actually don't give that safe space for them, what will happen is that they will never come and tell you if something has gone wrong. And this is whichever team you're working with, whether it's clinical, research teams, or your education teams. So creating that atmosphere of safety where you tell them about your mistakes, so they tell you about theirs. And fostering innovation, like I said, trying to make sure that you are actually allowing people to grow. The other thing that I really am, like they've created this new terminology called not having hippos. So hippos is what they're saying is the highest income paid person's opinion. Okay. You should actually have no hierarchy. My teams don't have hierarchy. So I do not believe that, you should have that hierarchical system where only the important people are allowed to talk and not the others. In my team, even the lowest person, so if it's a clinical team, the healthcare assistant, which we have, is the lowest grade person working. They're all allowed to give their opinions when we're having a meeting. And often it is they who come up with these bright ideas where you can actually make the change easier. So in our team, there's no hierarchy. And then like I said, the balance of when would I actually intervene and when you'd actually get out of the way. And this is important for me because one of my issues or one of my weaknesses is that I'm a control freak. I'm such a control freak that I want everything done in that time and I want everything done in a systematic manner. So I tell my teams that I say, you know what, I'm a control freak. Okay. So when I get into that space in a meeting, you need to call me out. You need to stop me and say, Geeta, you're going into that space. Come on, let it go. We know what we are doing. So that's really important as well. So I think those are important.
Nice. My last question, how your stay at Trichur helped to bring up your career in UK?
I think in a lot of ways. Okay, so I met loads of great people in Thrissur, starting from Dr. Krishnamurti and Dr. Vijayalakshmi ma'am. They both were really very instrumental in how I actually shaped my career in ophthalmology. If I had not been given that opportunity to go and do retinal surgery, it would never have happened. Professor Mary Kuriakose madam is been very, very instrumental in so many things that I have learned and done. I used to go to the medical college to help her and it was so nice. Madam has got this very calm personality. And I really learned that from her. Everything going wrong, you need to remain calm. It's really important. And I think I was very lucky to stay with my wonderful in-laws who actually, again, allowed me to grow, supported me in everything that I did. And I mustn't forget my poor long-suffering husband. Like his cousin said, when we celebrate our 25th wedding anniversary, he said, Chaitima, when even for a life sentence, it's only 14 years, and my poor brother has been suffering you for the last 25. So, yes. So Trichyur is a great place. And I think lots of the things that I did, I probably wouldn't have had an opportunity to do elsewhere. Elizabeth and Kallus are all witness to all the fun that we've had.
Thank you, Dr. Geeta, for all your deliberations. Thank you.
Thank you, Alexa.
Okay, so maybe we can move on to Andrew sir, the other person who knew Geeta madam very well, and please lead the interaction, sir. Andrew sir.
Welcome, Dr. Geeta. I think we know each other since 1988. You came to Trichyur. But before that, also I know you because we all have a PG at Ahmedabad. And Dr. Professor Nagpal is my boss at Ahmedabad. Anyway, we know each other. So, but the last 20 years also, we used to meet each other at all India Ophthalmic conferences. I think you used to come all conferences. I never missed a All India Ophthalmic conference. So every year we are meeting. So you have a wonderful talk, especially the leadership. That's a very wonderful talk. I appreciate you. Thank you very much.
Thank you.
One question, most of my questions are answered by you. So I am wondering where to start. Anyway, I'll start with the last question asked by Alexa. You have experience in Trichyur. You have a lot of people in Trichyur, Ahmedabad, UK, etc. But at least there will be some role model or some mentor or a mentor in your life, a turning point for you. Whether it is Nagpal, whether Krishnaguri sir, Vijayalakshmi ma'am, or Mary Vidakos. Can you pinpoint anybody?
Okay, so I'm going to surprise you. So I'm during the different phases in my life, different people have inspired me. So there isn't one person. However, the inspiration that I have got from my parents actually is responsible mainly for all my values and culture. And why is that? It's because, my father, he's the one who taught me the value of helping others. My father is a self-made man. So he left the small town of Irnyalakuda at the age of 17 and, worked and studied, and he got 3 degrees, including a law degree, and then, retired as the Assistant Commissioner of Income Tax. But when we were in Ahmedabad as a child, I used to see how my father used to bring people from Irnyalakuda, bring them into Ahmedabad, get them jobs, help them move in their career, and settle them down. And it was amazing how he did it. And my mother used to support him in doing that. So that's what I used to grow up, seeing, and that has really made an impact in my life. And that's what I actually do now. I actually have supported. So, just because I took the circuitous route of becoming a consultant from a staff grade doctor, I have managed to actually get lots of my colleagues who have come from India as staff grade doctors, and then moving them on to become consultants in the same way that I did. So I think that has had a really big impact on my life. And then like I said to you about my mother. So my mother has taught me, how about humility, and she's also taught me about failure. So she, like I said, always tells me, Molu, ahangaram vanda, don't be proud. That's her standard dialogue. And she was a full-time teacher, and she still was mother, looking after 3 children. And she never gave in to failure. I still remember, I am a morning person, and I used to get up at 3 in the morning to actually study for my exams. And she would wake up with me at 3 o'clock, make me a cup of tea, even though she had to go to school that morning, later on. So it was just amazing. And I used to always feel, I wish I could give at least, even 10% of that to my son when he was growing up. But so, I've learned all those qualities, and I think that is what has made me what I am today. So yes, lots of people have inspired me along my journey, Andrew sir, but, my parents still remain the center or the core of all my values.
Okay, Ida, you are lucky to have such a loving parents. Anyway, you are still love your parents. So we are all lucky with our, we still remember that is something missing in our younger generation. Anyway, lucky. So you have so much turning points. So you are born and brought up in Ahmedabad. You have to shift to Thrissur, then to England. So you are so much turning points. So in your history also, you already narrated everything. But from you are establishing a retinal unit in Vijay Sri, suddenly you shifted to England. Is there anybody, any motivation or anybody inspired you, or you already told your brother is in England? So who is the inspiring point? What's the turning point? You already explained. Can you little more explain?
I wish I could say that there was a eureka moment when I thought, okay, now is the time I need to move to England. It didn't happen that way at all, actually. Like I said, there were personal circumstances. And when that happened, my brother saying, come on, you need a change, just come here. But I think the person who really inspired me to do some of it probably was Professor Abhay Vasavada. So Abhay Vasavada came back from Moorfields Eye Hospital and started his journey in ophthalmology in India whilst I was a trainee and doing my post-graduation there. And I still remember him literally holding my hand and teaching me to do extracapsular cataract surgery, because in those days, intracapsular cataract surgery was what was being done. And I had my posting with him for a year. And I remember him actually saying, you know what, I think you need to move from extra to intra. He taught us to use the microscope. He actually initiated me into the world of research. He was the one who basically, I still remember, I'll never forget it. The first research project that I did was actually measuring intraocular pressure drop before cataract surgery. I don't know how many of you have ever seen that contraption. We used to call it the dancing doll. It was this iron thing that you put on top of the, Elizabeth is laughing, of course you do. So, and we had a ball, we had 3 gadgets, and we had to actually look at how much the pressure drop, the difference in pressure drop was. And he also asked you to do diurnal variation. And he was a very strict professor. So, diurnal variation means that you had to go to the ward every 2 hours to actually check the pressure of the patient. And he would actually ask the patient on the ward round the next day saying, I hope you were able to sleep all right last night. And then the patient would, if the patient hadn't been woken up at night to check the diurnal variation, he would know that the patient, you had not done it. So he was the one who initiated me into research. And he always used to say, when, Geeta, I think, you need to go to the UK, you need to get the fellowship exams. It's a really different world out there. You're living in your well here. And, so all of those things probably ended up me planning to go to the UK. So it wasn't one thing or one person or one day eureka moment, unfortunately.
Okay, thank you, Geeta, for sharing. Abhay Vasavada, I know because he was a professor in Nagari, and he was my examiner for MS exam at Nagari Municipal Medical College. You are the MS there. So he's an international phaco surgeon now. So yes. So okay. So that's anyway. So we want to know, everybody has some role model or some inspiring teacher. Abhay Vasavada is the boss. Okay, good. So you shared with your parents, your father was such a loving and he has helped all the Kerala coming to Ahmedabad. I know lots of Malayalis are in Ahmedabad. Now I'm in England. You are a PG director or something. And you are all National Health Service also. You are health. What is your advice you want to give the youngsters in India or Kerala? Because now Kerala is saturated with ophthalmology, I think. So many people are looking to England also. So what is the chance in England? So can you share any chance of coming to England, flap exam, or what is the things? Can you give some advice? A lot of PGs are attending this conference. What is your advice to our youngsters going to England for a career? So you established in England, so same way, something like that. Can you give some advice to youngsters? What is the chance in England? Something like that.
Yeah, I think that if you take the fellowship exams, so if you've done your post-graduation in India, then if you take your fellowship exams, then you get GMC registration. So you need to get GMC registration to work in the UK. And so that's the way you do it. and you could come in, and then unfortunately trying to get into the training program in the UK is quite difficult because the visa rules have changed. And so, you know, since 2014-15, you're no longer allowed to go into a training program in the UK. But you definitely can take your fellowship exams. So if you've done your post-graduation, take your fellowship exams, then you get GMC registration, then you come and work in the UK. And like I said, if they then recognize some of your training in India, then you can go onto the specialist register.
So
of course, you've got the PLAB exam, but PLAB exam, if you take the PLAB exam before you've done your post-graduation, then I don't think that it would make much difference because you wouldn't get into ophthalmology.
Will you get a fellowship? I think I heard that it's very difficult to get a fellowship or something attachment for ophthalmology.
Not that fellowship. What I mean is the FRCS.
FRCS, okay.
The exam fellowship. That's what I mean.
But after that, when you somebody come to England,
after that you will definitely can get jobs which are middle grade jobs. You know, like I said, specialty doctor jobs which you can take.
Okay, England, you are a great surgeon, retinal surgeon, macular surgeon, doing cataract surgery also. Then you turn to research also. Now you are a PG teacher or research dean or some PG training everything. So administration mainly. So first a surgeon, then a research, now administration. So I am also like something like that. So which is you are giving more important now, administration or research or as a consultant?
All of the above.
All of them.
All of it.
So yeah, all rounder. Okay, thank you, Geeta, for sharing with us. It is some personal questions. Okay, anyway, you shared everything. So thank you. I want to ask some change questions because Alexa already covered all the leaders, all the things. That's something great. So this is something for the youngsters, actually. Okay, thank you.
Thank you.
So thank you, Andrew, sir, for those useful questions. Now, now I think we can call upon Elizabeth ma'am, who very apparently, I mean, she is, already Geeta madam has mentioned who Elizabeth madam is and is to her. So I think she will be the next apt person to lead this discussion. Please, Elizabeth ma'am, please.
Can you hear me?
Yes, ma'am.
Okay. Geeta, so happy to see you. And it was a pleasure talking to you yesterday over the phone. And that was a great talk. And it should certainly inspire the next generation. We at Vijayashree, we always reminisce about the good old days when we used to go around attending conference, paper, presenting, and bringing home awards galore. Even then, I knew you would go places. You were focused, you were talented, hardworking, and ambitious. May God bless you, Geeta, and may you reach greater heights in your career. Now, on to my question. While transitioning from an ophthalmologist to a leader, what has been your biggest challenge?
Yeah, I think that moving from that space. So you first took up leadership roles in ophthalmology itself. So I think the example that comes to mind was early on in my career as a consultant. I took a proposal for the mobile macular unit to the exec board. So the exec board consisted of white male middle-aged men, and I was given a 10-minute slot to present. Now, you know me, I am really good at negotiation, or I thought I was really good at negotiation at that time. And I only had done 5 minutes of the presentation, and halfway through they just stopped me, and with an element of ridicule they said, oh, this thing isn't going to work. Now, none of them really knew me very well. Like I said, I was just a new consultant at that time. And it was as if that committee had actually stereotyped me and judged my project even before I presented it. So what I then did was I learned that I needed to actually do something different. So I picked a few people from that committee and I individually went to them and I spoke to them about the project. I told them all the different options I'd considered before coming up with the mobile macular unit idea, etc., etc. And then I went back again to the committee to present. It was the same presentation, and it got, accepted the second time round. And, we had the first mobile macular unit in the country. But I think, like, what I was trying to say is that, transitioning from the ophthalmologist to a leader was not more about the ophthalmology and the leader characteristics. It was more about that journey of being a female in that diaspora of males. And it was also about being able to, negotiate with them and get them to, learn that, I learned a valuable lesson actually that time, because it was about unearthing that inherent bias that was there in them, because they had judged me even before I had started, that, who's this little Asian female coming, petite woman coming and telling us what to do. We know how to actually make that change happen. So it was kind of that attitude. And it's not, it's interesting, Elizabeth, it is not even just in this sector. I mean, it happened a few years ago. I was coming to India, and for some reason, I was lucky. I was upgraded to first class. So I had to land, and that afternoon we were going out straight from the airport. So my mother had, as usual, rung me up, and she said, "We're going to meet so and so. So don't come in a dress or anything. Wear a chudidar and come," and all that. So I was wearing a chudidar that day. And I was standing in the first class queue, and there was this white gentleman behind me, and he basically taps me on the shoulder and he says, "Lady, this is the first class queue." Okay, so he's already made that assumption. So I just turned around and smiled at him. I didn't say anything, I just smiled at him. Then he assumed that I don't know English. So he took out his boarding card, and then he points to first class and says, "This is a first class queue." So I just took out my boarding card and showed it to him. So, that's how it is. So it's about, that journey. It's like sometimes you're walking to trickle, you're trying really hard to move forward, and, you have got 100 million people that are trying to pull you back. So that is the time when you really need the support of your, family, your friends, and everybody saying, "You know what, you are in that right space, go ahead, forge ahead," kind of thing. So yeah, transitioning from ophthalmology to a leader wasn't the point. It was the point about just transiting into that leadership space as a consultant, as a researcher, as an academic, as a educator, in every part of that journey.
Okay, so on to my next question. What is the best piece of advice you have ever received so far?
Okay, so it's the advice that my mother gives me every time. So when I ring her up and tell her about my, I failed at something or something like that, then she will tell me, that it'll all be all right in the end. If it's not all right, it's not the end. So that's her kind of standard, this thing. She said, "Don't worry, it'll all be all right in the end." And she's so right. And I think that is a great piece of advice for me. And that's what I tell my son now. And, they say that as you age, you become like your mother, isn't it? And that's exactly what's happening. Sometimes Prashant stops me and says, "Oh my God, Amma, you just sound like Amuma." Yes.
So what is your most useful resource, like books, blogs, meetings, conferences? Where do you get your inspiration from?
Right. So this is going to really sound funny to you. So first, I used to be a real pessimist. I know you might find it hard to believe. And one day, I think my son was about 12 or 13 years old. He got me this book called The Secrets by Rhonda Byrne. I don't know if any of you have actually read that book. It's a very small book. And he said to me, "Mom, you should read this book. Amma, this book is important because you're always pessimistic." I always used to tell him, "You don't study, you don't do this." Every time it was a negativity, And to tell you the truth, it sat on my bedside table for about 4 months before I actually picked it up to read. It's really made a big influence on my life, in the sense that I actually now am able to do positivity to the core compared to what I used to be. And that is why I can bring that positivity to my team. In fact, every patient that I've had with chronic CSR, I give them advice to go and read that book. And And it's very simple. It gives you things like, so normally what happens is, if say you want to buy a car, you want to buy a BMW car, and you sit and think about, oh my God, I don't have the money for it, or it's not going to work, and I can't drive it, etc., etc. Instead, what they tell you to do is you just kind of put that thought into the universe. So, imagine yourself driving that BMW car, and, it'll happen. When you put a delivery order on an online delivery box, you don't actually then worry and think about it. You just let it happen, right? So that's the way to do. And I actually proved it to my team when France won. I said to them, I said, all I did was I said, France is going to win. And it, that's how it works. But you don't bring negativity into it. I think that book really has helped me as a leader. And the conference that I really, really liked that I have been to was the Howard Macy Institute leadership conference that I went, not conference, course that I went to, which was last year. And it was leading innovations in healthcare and education. As you can imagine, I've attended lots of leadership conferences and summits, but this course was absolutely brilliant because it actually addressed the practicalities of leadership, as opposed to actually sitting and discussing all the different theories and what is right and what is wrong. It's all the simple little messages that I was giving you today. That is all part of that leadership course that I attended. So that was the course that I really liked.
Okay. So what is this one thing you would like to learn or work on in the coming year?
Okay, so I have taken on the role of being the lead dean for cancer and radiology this year. And with the pandemic, as you can imagine, cancer is in a very bad place at the moment. So I hope that, I can use all my energies and all my skills in trying to get that into a better place, because at the moment, patients are not coming in because they're worried about the pandemic. So they are coming in end stages of the disease when it's too late. And secondly, because we have had to stand down all of elective surgery, there's a backlog of patients that need to be treated. So diagnostics wise, as well as, surgery wise. So that's what I'm going to be focusing on, besides all the other things I do. Yeah.
Okay. So what does your typical day look like, and which part of it do you like best?
Oh my God, Elizabeth, do you really want to know what my typical day looks like?
Sure, sure.
So,
because now we have more female ophthalmologists, and they would certainly like to hear that from a person like you.
So when I introduce myself to my teams, the first and foremost thing I tell them is that they should never emulate my work, emulate me as far as my workload is concerned, okay? Because I am a born workaholic, unfortunately. And that's how I am, and that's how I will be. So I don't think that, people should look at what I do in my day. Yeah. But I think jokes apart, so my day starts in the morning. Like I said, I'm a lark than an owl. So I wake up in the morning at 5 in the morning. I usually am at work by 7. And my week has 13 sessions in it. So basically each session is 4 hours. Of those 13 sessions, 5 sessions are in clinical and research world, and 8 sessions are as a postgraduate dean. If I'm clinical, then I might either be in theater or in clinic or my research work. If I'm in the postgraduate dean space, then I will actually be going into London normally. So I work in London on those days. I take the 5:56 train in the morning, and I only get back home, whether it's clinical or otherwise, 8:30, 9 in the night. So that's what my typical day is like. So I know what all of you are thinking. My God, that poor husband of hers, right? Yeah. I think, and then I also have all the other things that I do, which is over and above what I do. This, for example, my work I said in Africa, I actually have now spread that to the Caribbean island of St. Lucia, and I'm also doing some work in northern India for that same links program. Then I work with on differential attainment. Then I'm on some of editorial boards, etc. So all that happens in the evenings, etc. The thing that has happened is that now that I don't have to travel into London, you would have thought things would have become better. Unfortunately, what it has meant is even that train journey now has been filled with meetings. So, you're sitting at home doing meetings every day. But I must say, I really enjoy every bit of what I do. So whether it's research, whether it's the teaching element, or whether it's looking after all the trainees, because being postgraduate dean, you're looking after 4,000 trainees in South London, which is from all specialties, so not just ophthalmology. So every day is different, but I hope I'm trying to make a difference with all of it.
So your hands are really full, Geeta, and I think the youngster should learn from this that without pains, no gains.
The best thing that I forgot to tell you, so the best part of my day is, if it is the weekday, it is actually FaceTiming my grandson. So that is the best part of my day. And it's the weekend, then going and visiting him.
So thank you, Elizabeth ma'am. Elizabeth ma'am, are you done, or are you done with the questions, or do you have further discussion, madam?
Oh, no, thank you, Latika.
So I think we can move on to our next person, that is our own president, Dr. Marine Paul. Will be taking a few, will be taking a few questions for Dr. Ketan.
It's truly an inspirational talk, Dr. Geeta. We at TACO are truly privileged to have heard you in this. And now coming to a couple of questions that I have to you. I think you covered most of it. But again, for a little bit more of clarity, I would like to ask you, how has being a woman in an era of male leaders impacted your growth? Could you share both the positives as well as the negatives of being in this role?
I think that, like I said to you, my journey when it started at Frimley, where I was the only female amongst male colleagues, and I am not joking about it. It was the case. It could have gone either way. Yeah, they could have just ignored me as a woman and left me be in that role, and I could have been their handmaiden for all my life. I don't know, I was really lucky that they actually did the otherwise. So that was a real positive, where all of them decided that I should progress in my career and actually sponsored me to go up that ladder that they were at already. And that really is I'll never forget that incident. And similarly, my chief exec of the hospital, creating a consultant job for me in that department. He didn't need to do that either. But it's not always been, it's of course it's been hard as a female. I mean, if you're trying to go into that leadership world, and especially in the academic and research side, it's much more difficult, because they just kind of want to push you down, because it's filled with all of these people who are white middle-aged men who actually want to be in that space and do not want anybody else in there, because they think they're the cream de la cream of that society. So getting into that space and doing research, getting that recognition that you are there has been hard. So that has been the more difficult part of it. So, but in the educator world as well, I mean, I was the first I was the first ophthalmologist in the country to be a postgraduate dean. It had never happened. And I'm only the third female dean in that space. So, I think that it is a journey, but what has happened in the UK is now they have actually been focusing on the fact that there is so much of a differential attainment between females and males. The gender pay gap report has just been published. They now have RES data, which is workforce race equality data. And that actually has really shown the stark reality of what it is that, how females are never going in that space. And now people are forced to actually look at it. So, you used to go to Royal College conferences where they would only have manels, that is only males on a panel. They wouldn't be a single female, or they would then bring a token female in there, so that they tick the box. And I remember going into this committee a few years ago, and I was the only female there in that whole committee, male with middle-aged white men. And every time I would say something, somebody would talk over me. Every time I would come up with a suggestion or an idea, somebody else would say that same thing. Some other guy would say the same thing in a different way. And his ideas, they would all be like, yeah, this is great, so and so. So I sat to 2 meetings. And then the third meeting, I just went to the chair and I asked him, I said, what is the point of having me on this committee? Is it that you think I have something to offer? Or is it because you wanted to tick the box that you wanted a female on here? And if it's the latter, then I think I'll just resign. I don't think I want to. I think that calling that out was hard because, you never know where it'll fly, right? And then things changed. I said, we need more females on this committee. Why are we only having one female? You're talking about this, but this is more important than that, etc. So yeah, so I think it's actually calling people out in that space is becoming more now. People stop and say, hang on a minute, and they make fun of it on social media that, they look at this manel, they don't have any females on it, etc. So the journey has started, but it's still a long one.
Yes, truly. Because even in India now, with the ophthalmology is truly becoming a female-dominated specialty. But you'll find that in all the panels, still it is. But having said that, I feel that in India, the tilt towards females is now becoming more, pronounced. And like you said, people are calling it out. So I think you have already answered this question. So you feel that being a woman leader, especially from a BAME background in healthcare, is definitely, I think, more difficult in the West than in India. I think you would agree with that.
Yeah, I think that although when I started my journey in India, I think at that time as well, females were not very, very, invited to the party kind of thing, right? So there, I remember when I started my fellowship with Professor Nagpal, I was the only female amongst those other four male fellows. So when I went in there, for the first week, they were absolutely appalling. They would not actually talk to me. They would not tell me what was to be done. They would not actually tell me where I could go and get my lunch, nothing for a week. Then what happened was that Professor Nagpal, whenever he had to go outside for conferences and things, he would do his surgery right early in the morning. So he would start the ward round at 5:30 in the morning, and then we would start operating at 7. So on one of the first time that happened, I went in there. I got there at 5:30 and I did the ward round. I sorted everything because I was a junior fellow there and sorted everything out. That was the day these guys then decided that they would actually deign to talk to me. And that's when I came to know what they had decided was that A, she's a female, B, she's coming with a 1-year-old child. So all she's going to do is make excuses and not come. They had actually taken that the liberty of actually, putting me into that box, that this is what is going to happen. And so they had prejudged all those things. And that is why they thought that I would never stay back till 10 o'clock in the night when we finished every day and come back again early in the morning. So that was India. Then after I finished my fellowship, I went to Arvind Eye Hospital. Elizabeth and Kaluz will know this. I went to Arvind Eye Hospital in Madurai to understand how to set up a VR service at Vijayashree. So I went there and I went to see Nam and work with him. And he's great, I was great. He was telling me all these things. And in the afternoon, I was sent to one of the clinics with one of his senior consultants. This person had not known what I had done or anything. He just, thought I was one female who was aspiring to be a VR consultant. And he sat me down and he said, vitreoretinal surgery is not a female subspecialty. This is what he told me. He It's not a female subspecialty. You should go into ocular pathology. Right? So even in India, but like you said, I think if you're from a BAME background, it's a double whammy in the UK, because they really kind of, and it's interesting, this is India, this is the UK, but even in Africa, even in a place like Africa, if you're a female, it's a very alpha male dominated area. So to try and get those males to actually sit down and talk to you, and when you're explaining things and getting that kind of this thing from them, attention from them, is quite hard. Interesting.
Now, my last question would be like, I'm sort of taking the focus away from you to your mentees. So what was that leadership or mentoring decision that you took which impacted a student or a mentee's life most positively? So what are you like most proud of?
I think what I'm really most proud of is what I did in Zambia. So, going there, and it actually was a female consultant there, Lillian, and getting her to go into that space of, helping me set up that diabetic retinopathy screening, and helping her get into the research world, which they'd never done at all, and bringing her forward as somebody and she's done really well now. She's, a solo consultant in another hospital now, and she's done really, really well. I think that was probably one of the best leadership decisions I actually took. And, I managed to get a grant for her. We had a mentorship grant that I got, which helped me actually get her, trained in research, and, and she presented at the Royal College of Ophthalmologists her first paper. So yeah, it was really good.
Well done. That's really so inspiring. Thank you so much, Dr. Geeta. It was such a pleasure talking to you, and I'm sure this entire session has been helpful, not only for the juniors, but for every one of us, because you have brought up a sense of positivity in these very, very dark times. Thank you so much.
Oh, thanks, Maren. You're very kind.
Latika, can I say something?
Sure,
I don't know whether you remember an eminent retinal surgeon, when you had just come back from your training, tell you, even though it was meant as a joke, only tall, dark, handsome men can become retinal surgeons.
Yes.
I hope you remember the person.
Yes, I do. Yes, that's because they thought that I could not actually, huh?
Maybe we have come a long way from that, at least. Okay. So, I think we are almost nearing the end of this time allotted to us by KSOS. So before we wind up, I just want to ask you three questions only, ma'am. What was the hardest choice of your life, and why?
Professionally, it definitely was.
Oh no, I meant in every way.
Yeah, I think it definitely was refusing that offer of the vitreoretinal fellowship and opting for the middle grade job. That was a hard decision, because at that time, that was my dream, you see. So to give that up and actually go into a middle grade job, have I regretted it? Not at all, because I think it was the right decision in the end, although it was hard to make with the whole family against it, and me saying, no, I think this is what I need to do, was hard.
So what was the one decision which you think now on hindsight, which you think might have been a wrong decision, which is a decision that you have regretted in your life? The choice.
Okay, so this is more of a personal one now. So it was basically last year in September. So I had fallen down the stairs and broken my right foot. And I was in one of those boots, that you get when you broke your foot. And everybody was telling me that, I shouldn't be going into London with that. I should just work from home. Did I listen? No, I didn't. So I went into London, and that was a week after that, I was in the boot. It was raining in London, and I was walking from one building to another for another meeting. I slipped on my boot and broke my the other leg, which then needed surgery. So 2 broken legs later, I realized that, you know what, the world doesn't revolve around me. And the fact that if I'm not there, things still happen and I'm not indispensable. Yeah. And so, yes, that was probably the worst decision. And I think I needed 2 broken legs to actually get me to that point.
Now, the final question of my only one more question, which is the best decision of your life that you considered as the best decision of your life, and why?
I think applying for equivalence training probably was my best decision. And, it's getting onto the specialist register, becoming a consultant has really offered me all those new avenues to move into and really help and make that difference, which probably I would have reached a glass ceiling, with the specialty doctor role. So yeah, that probably was my best decision.
So I thought it would be very incomplete without these questions, because ultimately the life we live are based on the choices we make. And so I think it is very important to learn from people like you, like how to make choices, which are the best and the worst. Of course, it is subjective for everyone still. So with that, can we wind up the session, or do we have any other questions? Otherwise,
before we wind up, Latika, can I say something? I wanted to just quote.
Sure, ma'am.
Yeah.
Please do.
I just wanted to, I don't know if you've read this poem. It's called Our Deepest Fear. It's by Marianne Williamson. And what she says is, our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light and not our darkness that actually frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? So, you're playing small in the world, she says, does not deserve the world at all. There's nothing enlightened about shrinking so that other people don't feel insecure around you. It's so true, you see. Yeah, it's insecure. We are all meant to shine. Yeah. And then she says, so as we let our light shine, we unconsciously give other people permission to do the same. As we are liberated from our own fear, our presence automatically liberates others. So really important lesson she's saying there,
Yes. True, ma'am. It's beautiful. It's said beautifully also. Thank you for sharing, ma'am. So maybe I should do my duty as, it is, I would really like to, I don't know, it has been such a different and unique experience. But it is my duty as secretary to wind this up now with a word of thanks, which is customary. So let me thank everybody involved who made this program a success. But most of all, let me thank KSOS. KSOS President Dr. Meena Chakrabarti Madam for having inaugurated the session. Our President-elect Dr. Babu Krishnakumar Sir for having conducted the virtual ceremony so much so well, and our Secretary Dr. Mahesh for having been on the platform to felicitate and encourage us, and most of all our Scientific Committee Chair Dr. Rajiv Sukumaran Sir for having been there as our support, both tech and otherwise, throughout the program. Let me also thank let me thank our awardees, Geeta Madam, for, I don't know how to thank her. I'm beyond words to thank her for all that she has shared. And Charles Sir too for his pearls of wisdom that he shared and the very vital message that he gave to the young generation of ophthalmologists. Let me also thank my own president, Dr. Marin, who was with me 100% in taking this decision of having a spotlight on such a topic for our annual CME of Tacopsia. So it was a difficult decision for us, but then she was there with me in this. And let me also thank my core team members, especially Dr. Anita, Dr. Sudha, Dr. Roland, and Dr. Bastin, for the innumerable ways in which they have supported me in this endeavor. I think I have not, even if I have left out anybody, please bear with me. I also thank our executive and senior members for having guided us at every stage of decision making in this, and all the rank holders, medalists, and their families for being part of this program. And last but not least, let me thank the audience, each one who has linked in and been part of this program. I hope you have enjoyed it, and it is you who have made our efforts worthwhile. So thank you, everyone. Thanks a lot.